Dr. Mark Changizi here through Science Moment. It's been about 2 years plus, 2 years and a month, that the COVID hysteria has been ongoing in much of the world, at least in the United States, at least in half of the United States, including where I am in Columbus. Things have been calm for more than a year. But in still certain parts of the world, like in Canada and some of the blue states of the United States and certain places in Europe, and things are still ongoing. Discrimination against the unvaccinated is still ongoing. And in much of the world, the developing world, the consequences of the lockdowns and the shutdowns and the aim to minimize one respiratory virus at the expense of everything else is still being felt and probably will be felt for a decade or longer. And I wanted to just walk through many of the kinds of articles that came out in mainstream news in 2020 and in 2021 concerning the kind of devastation and setbacks that have gone on in the developing world. Often in these articles, they'll say, oh, the pandemic has caused these problems. No, it's not the pandemic that caused these problems in the developing world. It was the panicked reactions and the different kinds of non-evidence-based changes to how certain kinds of other diseases were being treated, and how suddenly they stopped treating those in the same way, and they stopped allowing people to go to work, and so poverty rose. All of these things were due to the irrational behaviors and irrational interventions, not due to the pandemic itself. So this is really a sort of comes out of a thread that I started keeping as of August 2020. And it's a long thread, and it's important to go through to remind ourselves what happens when you try to freeze economies, when you try to make panicked changes and to stop one thing, when there's hosts and hosts and hosts of costs that always have to be calculated simultaneously. So let me start going through these, and I'll try to put screenshots of each of these as we go along. Start off in August 14th, 2020. This is from The Conversation, and I'll just be giving short excerpts from each one. 2 out of every 5 adults interviewed between May and June of 2020 reported that their household had lost its main source of income since the lockdown started. This has had devastating consequences for household food security and hunger, and this is concerning South Africa. August 14th, Ecuador and Panama. Families are struggling to buy basics like food and medicine as livelihoods are destroyed and the number of people out of work in the region hits 44 million. That was CBS News. France 24, posted on August 14th, 2020. Coronavirus and its restrictions are pushing already hungry communities over the edge, killing an estimated 10,000 more young children a month as meager farms are cut off from markets and villages are isolated from food and medical aid, the UN warned. Here's a Nature article that I posted in August 14th, 2020. AIDS, malaria, and tuberculosis, 3 of the deadliest infectious diseases together kill 2.4 million people every year, with TB alone responsible for 1.5 million deaths. And deaths from these diseases could almost double over the next year. August 14th post from New York Times. Tuberculosis kills 1.5 million people each year. Lockdowns and supply chain disruptions threaten progress against the disease as well as HIV and malaria. August 14th, 2020, from phys.org. In a best-case scenario, GDP per capita will recover to 2019 levels in 2024. In the medium case, Africa will return to 2019 levels in 2030. Here's a Medical Express article posted August 14th, 2020. Malaria-related deaths in sub-Saharan Africa in 2020 could be more than double those of 2019 if malaria prevention activities are interrupted due to COVID-19, suggests a modeling study published in Nature Medicine. August 14th, 2020, from New York Times. People have gotten to the point where they just don't give a damn, said a minister in Kansas City, which is on pace for a record number of killings. This one wasn't quite in the developing world, but it kind of was. September 16th, 2020. New York Times. Worldwide, the population facing life-threatening levels of food insecurity is expected to double to more than 250 million people. September 17th, 2020. From Open the magazine. I was powerfully influenced by the visual images of the millions of migrant workers literally on the march by foot over thousands of kilometers, trying desperately to make their way back to home villages as all work dried up. Many died en route. This is an article called The Tyranny of Coronaphobia. September 28, 2020, from The Intercept. The number of children who do not have enough to eat has soared in the pandemic, according to the Census Bureau and Agriculture Department. September 28, 2020, from New York Times. The surge in child labor could erode the progress achieved in recent years in school enrollment, literacy, social mobility, and children's health. October 6, 2020, from the World Bank. Under the baseline scenario, we estimate that COVID-19 interventions will push 71 million into extreme poverty. October 6, 2020, from the Wall Street Journal. The COVID economy carves deep divide between haves and have-nots. October 7th, 2020. Sharp rise in those below the poverty line due to COVID-19 interventions. October 11th, 2020. WHO's Dr. Nabarro's main criticism of lockdowns involved the global impact, explaining how poorer economies had been indirectly affected. We may well have a doubling of world poverty by next year, and at least a doubling of child malnutrition. From the IMF. The IMF warns, this is the International Monetary Fund, warns that economic impacts of lockdowns could undo 30 years of progress on global poverty. October 15th, New York Times. The number of poor people in the U.S. has grown by 8 million since May, according to researchers at Columbia University. The Conversation, October 15th. The poorest 50% of workers, those who live hand to mouth, were affected 10 times worse than the richest. This is concerning South Africa. October 20th, lockdown homicides. In Newsweek, homicide rates for 2020 have soared in at least 20 cities across the United States, with Louisville, Chicago, St. Louis, and Indianapolis recording double-digit increases over 2019. Increases have varied from 40% to more than 100% rises in homicides. October 21, Post. Our estimates of poverty consequences of COVID-19 lockdowns suggest that the number of poor people for the 4 biggest Latin American countries could increase by more than 25 million, using national poverty lines. October 21, 2020, posted from AP. The UN warns that millions of children may be forced into exploitative and hazardous jobs, and school closures exacerbate the problem. October 27th, 2020. Patients delayed medical attention or emergency room either out of fear or because medical care was not available. Substance abuse disorders and psychological stress may also be playing a role in excess deaths. This is concerning the observation in the New York Times that at least 100,000 of the 300,000 at the time, at least 100,000 were non-COVID related deaths back in October of 2020. October 31st, Halloween 2020, concerning Colombia. Millions of Colombians can no longer afford to feed themselves properly after lockdown measures devastated the economy. This is from Bloomberg. November 2, 2020. In the UN, lockdowns triggered devastating secondary health crises due to disruptions in life-saving health services. A 50% reduction in health services could cause nearly 200,000 additional stillbirths over a 12-month period in 117 low and middle income countries. November 9, 2020. Scientists have warned, this is from The Guardian, scientists have warned that several 100,000 extra deaths from tuberculosis are likely to occur this year as a result of COVID-19's effect on global health services. And note, tuberculosis targets much younger people than does COVID. November 11th. In March, the WHO ordered a pause to all polio eradication campaigns to make sure vaccinations going door to door weren't unwittingly contributing to the spread of COVID-19. As a result, 80 million children have been left unprotected against polio. And that was NPR. This is in the AP, November 19th. For every 2 COVID-19 victims in long-term care, there is another who died prematurely of other causes. Those excess deaths beyond the normal rate of fatalities in nursing homes could total more than 40,000 since March. November 28th, 2020. 40% of parents and legal guardians said their children missed their vaccinations because of the pandemic. The majority of missed appointments occurred when children typically get vaccinated before school resumes, the association said. This is from the New York Times. November 30th. If schools resume in-person instruction in January, the average student would suffer 7 months of lost learning. Black students would lose even more, 10 months. Poor students would forego more than an entire year. That's in The Economist. December 8th, 2020. Global contraction of 5%. 5 countries have defaulted on debt requirements, 20 facing severe food insecurity, 300 million jobs lost, and 100 million people pushed back into extreme poverty from the UN. And this is from a publication. School closures, December 9th, 2020. School closures during the COVID-19 pandemic. This is the title, Catastrophic Global Situation. December 11th, 2020. Analysis by Southampton University found that more than 1,500 clinical trials of new drugs and treatments had been permanently closed, while a further 9,000 had been suspended. So to stop COVID, go towards COVID zero, they've stopped or suspended 10,000 plus trials for other kinds of drugs concerning other kinds of diseases. December 16th, 2020. UNICEF has likened it to the Second World War. Since the first national lockdown in March, 2.4 million children were living in food-insecure households, and by October it said an extra 900,000 children had been registered for free school meals. This was in the New York Times, posted January 3rd, 2021. 10,000 additional children dying each month from hunger. The biggest cause of the global crisis in the coronavirus pandemic, but only indirectly. Outside of the rich world, the casualties are children dying of hunger because of economic disruptions. And I'm going to go ahead and stop there. What I'd recommend that you do, and I'm going to put a post to this thread of tears about the developing world here in the description of the video so that you can follow up for yourself. It goes on and on like this throughout 2021 and into 2022, and there may be 50 or more of these. Although these are being talked about in mainstream, nearly every single one of these was mainstream news or directly from the UN, we nevertheless don't hear much about these. Yeah, they're posted, but you really get no virality for these stories. The mainstream media doesn't really want to push it and talk about these things because they're the ones that fanned the flames that led to these consequences in the developing world, and they're embarrassed. And that was your science moment.